So a lot of people get hung up on how long do breast implants last, and I think what's probably more pertinent is how often do patients change their implants out. And what we find is for a lot of women, breast implants, it's not the rupture of the implant that is the most common cause of implant exchange. What's actually more common is that as patients age and as their life changes, there's kind of a life cycle to the breast implant. What you need in your 20s is going to be probably different than what you need in your 30s and in your 40s. As you have children, the breast changes, and you might want a smaller size, you might want a bigger size. What we see more commonly is that very normal for women over the life cycle of a breast implant to want to downsize the implant, and then over time, maybe even just take the implant out altogether. And that's a very normal sequence of events with a breast implant. So while most women are worried about how often does the breast implant rupture, probably what they need to most be aware of is that it's very normal over the life cycle of a breast implant to want to change it for one purpose or another. So if you have more questions, we encourage you to reach out to us. A lot of patients just have questions regarding their implants, the age of their implant, where they're at in their stage of life. So feel free to reach out to us if you have other questions.